Hi there, and welcome to the Creative Operations Podcast. I'm your host, Kevin Groom, and in this podcast, we'll be talking with creative operations leaders in all kinds of industries, from franchising to finance, from healthcare to hospitality and beyond. We'll be looking to uncover best practices and to see trends that are coming to help you keep your creative operations on brand and on budget at the same time. Enjoy. Welcome, everybody, to this episode of the Creative Operations Podcast 2.0. We're really happy to have you here with us today, and we're excited because, as you guys know on this podcast, we focus on sort of a little understood end of the marketing production business, and that is the challenge of keeping lots of different folks in the field on brand, on message, on budget, on time, all the time. And so today I'm really pleased to have with us Matt Koyak. He's the Director of Marketing of Regional Health in Memphis. Well, the interesting thing, guys, about Matt's particular challenge is that he's got this kind of problem, but writ large across a very complicated network of centers of excellence in various medical disciplines. And so a huge range of content and topic areas that have to be covered under one brand. That's how I understood it. And that's why we're so happy to have Matt joining us today. So we're going to talk more about that. But before we do, Matt, first, thank you for joining us.
Thank you for having me, Kevin. Appreciate it.
Absolutely. And tell us a little bit about how you got yourself into this whole situation in the first place in branding, marketing, and creative operations.
Yeah, so I started out as a graphic designer, and I started out doing agency work out of college. And as I was working on my graduate degree, I worked for Nissan in their forklift division out of Marengo, Illinois, and I was helping them with their parts marketing. So I started to get into what's now widely accepted as normal digital marketing and helping independent dealers market Nissan's products. And I just loved it. I loved every single thing about it. So I just kept adding skills to my tool belt as I finished up my graduate degree and got out of college and had my master's and started to carve out a career for myself. I found, it was less and less about, I'm an advertiser, or less and less about the specific design piece, and more about, okay, how do we tell stories and use the mediums that best connect with our audience? So that is where I focused all of my efforts on helping organizations, whether it's a small to medium-sized business or it's an organization that I'm working for at the time as kind of an intrapreneur, and helping them kind of connect with their audience, and doing so utilizing all of the things available to them from a marketing and advertising perspective.
It's amazing that entire careers can be built around this problem area, And when you mention dealers, in my view, we've seen this, at Pike and Nine. Dealers are an interesting part of the challenge because they're often trying to take one brand and put it right in next side another one and another one and another. And the notion of all these different brands colliding like ships coming into the same harbor just throws creative directors for a loop. And we've often seen, in several environments, we've seen where there's two ways you can go wrong. You lock down too tight, and you don't really meet the dealer's business needs, because he can't devote himself or she can't devote herself entirely to your brand with an entire full page ad. Or you find yourself loosening up so much that you lose some of the essence of the story you're trying to tell.
Yeah.
And so, it's really interesting that you come from that, which, of course, is a B2B kind of segment, and industrial manufacturing, et cetera. It has its own language and its own world. And you ended up in medicine, or at least right now in medicine, which is like a huge leap. So tell me a little bit about that transition for you. How'd that feel?
Yeah, the jump will make more sense in a second. And there's a little bit of a story, and I'll keep it short as not to bore the listeners. But so while I was working at Nissan, and a lot of what I now have in my repertoire as controlling a brand identity came from Nissan being so rigid. Japanese organization, all of that branding controlled overseas and then dictated down, and making sure everyone kind of follows. So brand guidelines, making sure that they're communicated clearly, making sure others are on board with how to communicate. That was what set that groundwork. So then after I left Nissan, in between, I had an agency I ran with my brother. We did our own, had a number of individual clients, small to medium-sized businesses who were looking to kind of do their own advertising in the digital space. So we were doing websites, we were doing paid search campaigns and things of that nature. And one of our biggest clients was a newspaper company who they were looking for ways to leverage their editorial content. And I say newspaper company, I really should back up. It was a hyper-local newspaper company. They had 75 publications in 9 different states, all small town, where the biggest headline is who scored the touchdown on Friday night.
You betcha. Hyper-local. Yep.
These were mom and pop businesses advertising in their papers, and then they had editorial content they were trying to bridge into the digital space. And they were finding that they're losing out to, my cousin designs websites in his basement, so I'm going to have him design my business, his website. I'm going to give him $500, but I can't run print ads this month because I don't have any money left. So they wanted to find a way to have somebody come in and kind of be a digital agency for their small business clients while also optimizing their editorial content in a new, at the time, evolving space of content marketing and paywalls and all of that kind of digital subscription-based stuff. And that's when I came in. So they were my brother and I, they were our agency's biggest customer. And they said, hey, look, I'm going to make you an offer and I want you to come work for us full time. And I couldn't refuse. It was that good. So I got into that. So I spent about 5 years working solely on helping them develop paywalls and websites, and then helping their small business customers, just like an agency would, advertise their business in web, do search, get into that without having to spend a ton of money or sacrifice valuable print advertising, which in markets like that was still huge, still very huge. So that whole industry started to slide off, and I started to think to myself, well, I think it's time to pivot. I've been here for about 6-7 years, and I started to think, okay, what industry to me is bulletproof? And I thought, well, my only individual expenses that keep hiking year after year are healthcare. Why don't I get into healthcare to where I don't have to pay for that anymore? And my son was just born. We were looking for jobs that were kind of halfway between my wife's family which is in Northern Illinois, and my parents are in Northern Florida. So we wanted somewhere halfway in between. And I saw a job open up here in Memphis at Regional One Health for director of marketing, and I jumped on it so fast. And it's just been amazing ever since. Little did I know that 13, 14 months after I started here, we're going to be in the middle of a global pandemic. So I definitely played the roulette wheel right in that respect. So here I am.
That's amazing. And, when we look at the Memphis market, you guys, as I understand it, have somewhere a couple dozen practices and facilities that are spread out across the entire metro area, which is quite a geography too. I mean, Memphis spreads itself out there a good bit. But So you've got a couple dozen really unique sub-brands that you are marketing under the Regional One umbrella. Is that fair to say?
That is absolutely correct. We're the oldest hospital in the state of Tennessee. We're the oldest business in Shelby County, which is the county in which Memphis is in. We are a level 1 trauma center, and our market is unique compared to other cities in the country where you might have a level 1 plus a level 2 and a level 3 to help take some of the burden off. But we are the only level 1 trauma center within 200 miles. We're also the only accredited burn center within 400 miles. So we have helicopters landing on our roof constantly. And that's just at our downtown campus. And then, as you mentioned, we have a number of primary care locations. We have an East Memphis campus that's expanding with a number of multi-specialty services. So it's just constantly evolving, as you might guess from healthcare. And we've onboarded a number of new specialties alone in just the last year and a half.
Well, there's two aspects of this I wanted to probe a little bit with you. The first one is the profession nature of healthcare and its impact on marketing. Because, of course, lawyers, doctors, folks in the professions are often tough clients. Because A, they've got deep expertise, and B, they develop that deep expertise because they're seriously smart. So it's really hard, to try and get a branding concept past a pretty stringent crew of reviewers. Has it been that way for you? Because I noticed, in the backgrounder that you guys have just launched, and just on the heels of the pandemic, a pretty big, branding initiative. Tell me a little bit about the creative approval process and how that works for you there.
Yeah, it's been an uphill battle, and the Regional One Health as an organization has struggled for a while with regard to branding. So they rebranded the hospital from the city's. It's still the city's safety net hospital, but prior to the rebranding, they were only known as the hospital for patients without insurance. And we still see all of those, but they've started to onboard all these other specialties and services that are more
Sure.
elective in nature. So they went
Yeah.
from being what was they were previously called the Med, and majority of Memphians still referred to them as that. But it's so much more. So all of our messaging since about 2015 when they did the rebranding to today had been about just trying to get away from the Med and become Regional One Health. And now we've just kind of bridged this gap or crossed this bridge rather to where we've gone. Okay, now most people know it's Regional One Health. They might still call it the Med, but in the heart of it, they know it's Regional One Health. So we started to come up with a new slogan to keep things fresh and keep things moving, which is our Specialize in Tomorrow's campaign. And that campaign was very, very hard to get approved. And it was really an awakening for all of us because we had to sit down and say, okay, look, we are the oldest hospital. We don't have shiny new buildings. We're in the heart of downtown. Downtown Memphis is known for grit and grime, and it's a very gritty atmosphere, and
And great music.
and great music. But we have so many competitors that have newer facilities. So we're like, okay, so let's have a heart to heart. Let's look at our brand and truly, like I said, we're not the newest. So what do we have? Well, we have all these amazing patient outcomes. So we wanted to design a campaign that focused only on the outcomes, caring not so much about the patients who come through our doors, but the ones who leave and can live tomorrow because of the care they received with us. So we had to do all kinds of vetting and make sure that, we're not saying things that aren't possible. We're looking at the specialties we want to highlight with regard to that. And, we wanted to make sure we weren't showing the stereotypical patient with a doctor smiling in a clipboard or on an exam table, but rather people like out in the city living, after surviving something that should have been the end of their life or the most traumatic thing in their life, and now they're getting on. So we had to really come up with messaging that spoke to that end. And that meant sitting down and looking at patient cases and said, okay, here's a patient who came in and he was impaled by a hay bale spike. And we saved his life, removed the spike, and then we did a whole story on it. And then, I think you probably know this, but, in our industry, we always run that we walk that fine line of telling a story that's important because this patient's life was saved, but not exploiting the patient in a way that benefits only us. So we're always doing that dance and making sure that we're not exploiting the patients that we are talking about.
Well, it's a really important point. And so tell me a little bit, knowing the emotional depth and freight of that, and I was a kid, I baled hay myself. So that story really struck home. but knowing the emotional depth of that, how do you take specializing in tomorrows and roll it out to really serve those individual local facility kind of, presences that you have? Have you guys found a way to really extend the campaign and give it those kinds of legs?
We have, and I was lucky to. One of the reasons I took this job was because they already had an in-house designer and an in-house copywriter, and they work on my team. I have a team of only 4, which would surprise most people. We do a lot of our own stuff in-house. We do our video with the to the extent of where do we have the sound and the lighting equipment that I'm happy with, or is it something we have to outsource because it's a bigger project? But we do quite a bit of our own work in-house. So when it comes to advertising or sending that message down to our other locations or even other specialties within our hospital or our organization, we wanted to make sure that we had this nice pool of patients. So we work with the providers and we have them recommend us patients who have great stories that might, are great patients that might have a story to tell. The other thing we do is we focus very heavily on our audience. And my team, we work hard to develop personas for each segment of the audience that we're trying to reach. So if it's a primary care location, we might look at the patients in that area and then pick 3 or 4 key groups, develop a persona for that group that we know it's one fake person, John Smith, but he's representative of this huge body of patients that go to that primary care location. So when I go to my team, I said, okay, look, we need a campaign to touch John Smith. I need you to develop some messaging for digital and for some editorial content, and then some content marketing and social media. They'll write it knowing he's our audience, and then we'll vet it with the primary care provider to make sure that everything we're saying is accurate and everything is in line. And a lot of times, we go back and forth on, and even just the way to word things, because the doctor, as you pointed out, speaks one way and then the patient speaks another. And we bridge the gap with our copywriter, and then we'll launch a campaign. We do a lot of A/B testing too, but I won't dive into that because it's kind of boring for most people. But we like to fail fast. So if something's not working out, we quickly pivot and readjust our messaging. But yeah, that's kind of the process we take in each of those situations.
That's great. Well, it's a great segue. I wanted to ask you a question. Unlike most designers, or I should say it's relatively rare, I think, to see a design background kind of person with Six Sigma in their background as well.
Yeah.
That's more of an MBA thing than it is a, School of Design kind of thing. So I wanted to ask you, as you look for ways to improve the efficiency and sort of the streamlined nature of what is essentially a creative process, how have you been doing that at Regional One? I mean, how's that been working for you?
It's been great. So we're lucky enough in the past. Let me back up. So right when COVID hit, there was a real frantic pace to get information out as quickly as we could. And as it's coming in, we have medical experts here who are deeply involved in everything the government was working on with regard to advances in vaccines and treatment and symptom management, all that type of stuff. And so we were really having to find a way to communicate that to our patients. So our organization spun up an EPMO project management team. And a lot of that, the tools that they use come directly from Six Sigma and Lean Six Sigma. So when we started to look at, okay, how do we tackle this? How do we get the information out to our patients about closures and checkups, and how do they get appointments quickly and all that stuff? We kind of spun up a couple of cross-functional teams and did a number of intensive discussions to find out how best to do that. So that to me is like, this was brilliant. It fits into our creative process from design standpoint as well. We look at what's the problem we're trying to solve, and we'll brainstorm ideas. We'll come up with affinity diagrams to kind of figure out, okay, what can we do fast? What can we do? What's going to take more time? What might take a long approval and our CEO to go through? And then what kind of marketing tools are available, even if it's evolving technology that we can use, like something like text message to do alerts and things to our patients. So we really wanted to make sure that we had this toolkit to keep those discussions organized, and that we were working efficiently. The other side of it is that as a marketing department, our budget is really tight, and we have to pick and choose what we can afford to spend our time and our resources on. So being efficient and being able to produce things quickly and be very agile, like David rather than Goliath, has really come into the benefit. And all of those principles come from Lean Six Sigma.
Well, that's neat. I am an old copywriter by trade. So you mentioned copy, and it's not often that I get an agency head or a creative director to sort of lean into the copy aspect of the business. So just one last question that I wanted to run past you. In the MarTech world, and we all kind of live in this world, we've been hearing, these rumblings about the impact of artificial intelligence, DALL-E, ChatGPT 4, et cetera, on content creation. And I was wondering, in the very delicate and also privacy-centric kind of world that you guys have to live in, have these tools begun to wend their way into your process or not yet?
And it's funny you mentioned that, because I've just started to implement some of those things with my team. So we started using ChatGPT last week, in fact.
Oh, wow.
And I'll tell you how we use it, because there's obviously an ethical side to it, and there's going to be I think we're going to see some really major discussions on this coming out of business, marketing, advertising in the next couple of months in terms of quickness. But what we use it for is to really look at, first of all, dumbing down medical content. So you can easily go in and say, explain to me focused ultrasound procedure for essential tremors, written in a ninth grade level, or in the tone of Christopher Walken, whichever you choose. So we look at that, and then what I've asked my content creation team to really focus on is using it to do the stuff that takes up probably more time than it needs to. Not that you're at all inefficient, but use it to create outlines that you can then write from or to. So, you can set up your editorial calendar for the month and use something like ChatGPT to help start bullet pointing the things you want to talk about. And a lot of times it's extremely effective because, we don't have the responsiveness we often need from the medical provider to get back to us when we write something after interviewing them and then send it to them to review. So if we can kind of eliminate the work, the time between when we write it and when he looks at it or she looks at it and says, okay, this term is right, this term is wrong, that's the kind of thing that AI can do for us. But then there's that whole other side of it, right? So with patient privacy, we're always in this industry stuck by HIPAA, making sure we're not violating any HIPAA. So we don't do a lot. We don't feed it we don't feed it any patient information. So it's just really using it to create outlines that we can act from just to make ourselves more efficient and reduce some time and it might take to produce a big body of editorial content.
Those are great and very practical tips. I just wanted to summarize it real quick because I thought it was, it doesn't just apply to you guys, but it applies beautifully to you. Number one, using it for outlining, folks. Think about that. ChatGPT 4 as a way to organize some thinking that would otherwise take interviews and days, calendar days, which you can compress down to seconds or minutes. Second, take the content that you develop from that and subject it to expert review. Don't trust ChatGPT or DALL-E or any other artificial intelligence tool not to make mistakes. Use that professional review, but use it at the end of the content creation process. And then the third point I picked up here, Matt, and I loved it, was you guys use artificial intelligence to dumb things down. I just loved that. So listen, I want to say thank you for taking time with us. This was a really practical, concrete conversation about an area that I think continues to benefit from kind of experimentation and, innovative thinking that often goes unseen, behind the scenes, because folks don't really know that creative operations is as all-consuming as it can be. So thanks, and we're going to come back and see you in a little while and see if you lost the name The Med sometime soon.
Fingers crossed. Thanks, Devin.
All right. You betcha. Have a great day. And everybody, we'll see you on the next episode of Creative Operations Podcast 2.0.